The National Association of People Living with HIV and AIDS, together with the Human Sciences Research Council and the South African National AIDS Council, will launch the HIV Stigma Index 2.0 report. Now, the comprehensive study sheds light on the persistent challenges and opportunities for positive change in addressing HIV stigma and discrimination in South Africa. The study now highlights the experiences of over 5,000 participants from all 9 provinces, with a focus on 18 districts, both urban and rural. For more on this now, here's SABC News reporter Patricia, who joins us now. So we commemorated World AIDS Day on the 1st of December, and I'm sure all efforts continue beyond this day. Good morning.
Good morning. Definitely beyond the 1st of December that we know is, of course, World AIDS Day. But you would also understand that South Africa is actually one of the countries that continues to battle with the realities of HIV and AIDS in our country. Also one of the countries globally that has the highest infecting rate. But I'm here with one of the researchers here at the CSIR, and that is Dr. Lehlohonolo Makula. Thank you so much for joining us. In short, of course, the event is expected to start around 10 o'clock, but ultimately the significance of the index report.
Well, thank you so much for having us. The significance of it is just ensuring that the experiences of people living with HIV in South Africa are documented to bring about change. We conducted this index as HSRC and South African National AIDS Council, providing technical support to people living with HIV in South Africa to lead and capture their own experiences in terms of stigma and discrimination in different levels of settings within community, be the healthcare sector, be within families and communities. And the purpose of it is that through understanding these experiences, we are able to see if there can be policy reform, if there can be campaigns that really change how these people experience access to services, especially in healthcare settings, so that we are able to also elevate situations where they are not able to also adhere to treatment because of healthcare-related stigma that usually is experienced by them. So today is about celebrating having had an opportunity to capture the experiences across the country, where they also indicated where the barriers still exist and where we are doing well. So just to note that this study is being conducted as a follow-up study that was also conducted in 2014. So what we are doing is we are comparing as to whether since 2014 and the interventions that have existed within the country, what has changed in terms of how the people living with HIV experience services, experience their interaction within the community, and are they comfortable disclosing their HIV status, and are they able to live the quality life that they are meant to live, and are their rights not violated. So that is basically the purpose of us coming together here, having the voices of people living with HIV, really taking the lead with just us as researchers from Human Sciences Research Council, really providing the technical support, but allowing communities to participate and lead in the stories that they want to tell to South Africa.
Not to run ahead of the report, but when we look at the past 30 years of South Africa's democracy, I think the early years there was a lot of stigma, and it caused a lot of problems, in particular in some communities. As a researcher, how prevalent is stigma? How prevalent is it still, and what's the impact thereof? If you maybe can just delve into that a little bit.
Yes. So I don't want to go much into the results. I think at 10 o'clock, through the leadership of the PLHIV sector and Mr. Sazini, we will really get to understand the measure or the level of stigma that still exists within South Africa and how that impacts people living with HIV. However, we are noting that there are still gaps that we need to attend to, and we are hoping that this will give us an opportunity as a multi-sectoral coordinating group that we work together to see how we elevate that this result results are not just going to be findings that are shared today and then they remain. We know that experiences of stigma have impact on one's psychological well-being. And when internalized, they make it difficult for a person to comfortably access services, which is what is critical for us to ensure that they are able to access services, their rights, they live the same way as any other person. So I think we hope that the viewers would be able to join us at 10 o'clock as we really share these findings, and also together as a community see how we can come together and help. We're just coming out of the World AIDS Day, but we need to also think about, as communities, how do we build and ensure that people living with HIV are part of community and participate in all the activities, including younger group. I think what is different about the stigma index that is conducted in South Africa compared to other countries is that we've included adolescents aged 15 to 17 because of the prevalence level there of HIV, and we wanted to document what their experiences are so that we're able to document them, have interventions so that they remain at school and it does not affect their livelihood. So we're hoping that through the sharing of findings and more discussions that we'll have, would find solutions that would enable South Africa to strengthen the existing campaigns and interventions.
Right, thank you so much there. Of course, we now wait for the final report to be delivered by Mr. Zazini.